Dr. Deena Adimoolam, thank you so much for giving us your time on ITV Gold today. I hope you're doing well.
Thank you, Aditi, for having me.
Of course, we have to have you because I have a lot of questions on COVID-19 and what's happening in the nation, so let's go right into it. My first question to you, new infections are up 50% across the nation. It is a little troublesome, and we are seeing an uptick of cases and even in deaths in certain regions of the nation. Why is this happening?
We believe that this uptick in cases is most likely attributed to the new Delta variant that is now present, affecting about 50% of the cases of COVID-19.
Right. When talking more about it, let's talk now about this Delta variant, doctors. Experts are saying that it's like COVID on steroids. And, that's the impact of that on the body. I'd like to know, what is it doing to the body and what is your take on it?
So the Delta variant is basically a variant of COVID-19 strain that's about 5 times or more infectious than the initial strain that was existing in the United States, which we believe came from the UK. It was called the UK variant. So we know that this type of variant is just highly transmissible, it's highly infectious, so it's very easily able to spread in communities, which is why we're seeing this uptick in cases in certain states.
How worried are you about this Delta variant?
I'm extremely worried about this Delta variant, especially in the states where people are not necessarily vaccinated to a higher extent. We know that in areas like Mississippi, for example, there's less than 40% of the population that's vaccinated against COVID-19. And so they're very high risk for the Delta variant, and they're very high risk of having other mutations develop as well.
Right. This brings me to a fact that came into the news this week. It's saying that 99% of deaths last month in June were of unvaccinated people. I'd like to know what you have observed, and do you agree with this?
Yes, so we all know that the vaccine was created to help protect us against severe complications of COVID-19 and death related to COVID-19. And so we can expect then in the unvaccinated population to see more people dying from COVID-19 as well as severe complications of COVID. So just because we live in areas where vaccination rates are high, there are areas in the country where vaccination rates are very low, where people are still dying and living in this pandemic and experiencing a lot of pain and suffering the way that many of us have experienced for the past year.
Doctor, there are some hospitals in the country that have run out of space again, that have run out of ventilators again, and it's happening in those low vaccination states. My question to you is, what should the state and local governments of these states do to increase the awareness? According to you, what should be their step?
As a physician and as a public health advocate, Aditi, what I've been noticing a lot in the population is a lot of myths out there about COVID-19, a lot of misinformation that exists there for the reason for why people don't want to get vaccinated. So I think the most important thing that we can do is start a really aggressive public health education campaign in those specific states to target what is it that people want to know about these vaccines, what myths exist out there. Because I can tell you with my own patient population, there's many questions and myths that my patients have that aren't necessarily founded. And when I explain to them the science behind what we believe the vaccine is capable of, then many of them feel less hesitant and they're able to then go and get the vaccination. So I think the best advice I have for those that are watching is to really talk to your doctor about the questions and concerns that you have about the vaccination. Don't trust WhatsApp forwards or misinformation that's propagating out there on social media. Go to the experts, go to the healthcare personnel who understand this disease and ask them the questions to get the correct information, and then make the decision that you want if the vaccine is right or wrong for you.
Right, and that awareness is so important. When you're looking at these unvaccinated areas, more than 40% of this nation is not vaccinated. That's a huge number. My question to you is now, how does that affect communities that do have high rates of vaccinations, such as New York, which has reached 70% of at least, vaccinated by 1 dose? How will these states get affected in the next couple of months?
So what we do know is that the vaccine, especially the Pfizer vaccine and the Moderna vaccine, which are popular in the United States, those vaccines are able to provide us a great amount of protection against the COVID-19 strain, especially the Delta variant as well. We have research that just came out suggesting that the Pfizer vaccination is 80% or above effective at preventing severe complications of COVID-19 related to the Delta variant. So I think that's, great news. So we're protected in areas where there's a lot of vaccinations. But unfortunately, what's happening in the areas where people aren't getting as many vaccinations is that people are still infectious. They're still transmitting the virus from one person to the other. And what's happening is in areas where people are transmitting the virus and the infection is raging, there's a potential for mutants to develop. There's a potential for that COVID-19 strain to mutate and become something different. So what can happen is that mutant can then enter into an area where there's a vaccinated population, and unfortunately, that vaccinated group may not necessarily have protection against this different mutant strain. So that's where the issue is. The propagation of new types of mutants of COVID-19 that can occur in unvaccinated states coming into vaccinated states and making people sick again.
Doctor, what are the chances of a vaccinated person getting COVID after the vaccinations?
The chances are very low, but it can happen. There have been many cases, breakthrough cases that exist. But what we do know is that majority of people who do develop COVID-19 after a vaccination, the rate and the likelihood of dying or having severe COVID-19 infection is very, very rare.
Yeah, and that's an important fact to know. On the vaccines, Doctor, Pfizer actually came out this week and said that it's seeing waning immunity from its vaccine and it's picking up efforts to develop a booster shot. FDA and CDC came out right away and said that right now we do not need a booster shot. Now, there's a lot of skepticism about this because Pfizer did come up with this news. Some of us have had the vaccine for a couple of months now. We don't know how long the immunity lasts. What is your take on it? And when do you predict this booster shot to be used?
So from the most recent data that came out at the end of June, it suggests that the Pfizer vaccine and the Moderna vaccine can provide immunity for anywhere from 6 months to a year at least. So we do have that data to help us understand that at least from the time we got the vaccination, there's some degree of protection. I think that only time is really going to tell how long that immunity will last, and many researchers are looking into that data to make sure that they're providing us a booster when necessary. I think the booster is going to become extremely important when it comes to the newer rise in variants. Like the Delta variant, for example, we know that there's some protection against that, but maybe there might be new mutant strains that arrive, especially in the areas where there's unvaccinated individuals coming into other states where we feel protected. And in that case, we're going to need boosters to be able to protect us against that. So I think as soon as we're starting to see more mutant strains arise of the COVID-19 infection, that's when we're going to need more boosters. That's when that's going to become more and more important to make sure that we have the protection that we need against any strain that's out there.
We are calling it boosters, but it's sounding like it's similar to what is going on with flu shots that we take every year, and I believe it changes depending upon what kind of flu is going on. So will that be similar?
Exactly. That's exactly what it is. So as we have more and more different strains that exist of the flu, for example, every year, then we have a flu vaccine that's designated to those most common strains that exist in our population to protect us. So that's exactly what we'll see. But I think the hope is that we can control these mutants of COVID-19 if we get more and more people vaccinated, so that the most common variants that are in our population are ones that we're aware of and ones that we're protected against.
Pfizer is also applying for full approval from the FDA. I want to know what that would mean, and does it just bring more confidence for a company like Pfizer?
I think that seeking full FDA approval might help a lot of people who are hesitant about the vaccine because they think that it's been created too quick, that they think that there's not enough data to support its use. So I think it might just give an official stamp to make people feel more comfortable and confident that this vaccine is working, that this vaccine is going to help prevent severe infection, prevent death, and has very minimal side effects. They might feel more confident to go get vaccinated and protect themselves and their families.
Right. Doctor, let's talk about vaccines in children now, because it's been a huge topic. Parents are concerned across the nation. We're hearing of some rare heart inflammation issues from the vaccine in children. How are you looking at that group of people that have been approved so far, 12 to 17? How important do you think it is for them to get the vaccines?
I think it's extremely important. I mean, the COVID-19 infection, as we've seen, it doesn't spare you just because you're young. There's many young people that are also getting infected. And if you look at the most recent data, that percentage of young people, even from 12 to 18, but even from 18 up to the age of 39, there's a very small percentage of people that are vaccinated in those groups, and we're still not at 50% and above. So I think there's a lot of room to do for anyone less than the age of 40 years old. But when it comes to kids, I think there's a lot of hesitancy out there, right? There's a lot of hesitancy amongst parents about what are the long-term side effects of these vaccines. And those questions are one of the things that should be brought up to one's pediatrician to make sure that they're getting the correct answers that will allow for them to decide to get vaccinated or not. So I think that, the vaccine is extremely important for everyone. I think there's a lot of questions again out there about, should I or should I not get the vaccine, especially my children, because I'm worried. And I think you need to have that discussion with your doctor to see if it's the right decision for you. But I do think that in schools where vaccines may not necessarily be mandated, people still need to do the proper steps to help prevent the spread of COVID-19 infection. They need to wear masks, they need to socially distance. I have a 3-year-old who's going to start school, and I want to make sure that, he's learning to do that now, so he's ready for the school year to help, prevent the spread of infection amongst my family members, amongst his own peers.
Right, and a lot of these children will not be vaccinated in kindergarten or elementary school or middle school. Right. They're not going to be vaccinated. So you fully support, them wearing a mask. You think schools should kind of require at least the mask if they cannot require vaccines?
Absolutely. I think that we have to follow the guidelines that the CDC has laid out for anyone who is unvaccinated, and that includes children. And I think children are, very susceptible to developing infection in general because they're constantly touching things, putting things in their mouths. So it's really important to maintain that social distancing, make sure that children are washing their hands, that they're wearing a mask to help prevent the disease as best as possible. And we actually have data from studies that have been done because we've been in this pandemic for more than a year now. We have a lot of research that has said that the transmission rate in schools of COVID-19 is extremely low if you follow all social distancing measures, staying 6 feet apart, washing hands, wearing a mask. It will protect us.
Very important message right there. Meanwhile, Johnson & Johnson vaccine is being linked to an autoimmune syndrome. This vaccine has come into a lot of question, since it's been in the market. How are you looking at that, and do you still suggest people get it if that's the one being offered to them?
So this autoimmune condition that you're speaking of is called Guillain-Barre Syndrome. So this is an autoimmune issue where you have your immune cells affecting nerves, leading to something called ascending paralysis, where people develop weakness in their legs, and then it starts to go up their body and develop other weakness of the arms as well as respiratory muscles potentially. So this in itself is an extremely rare condition. We rarely see it. I've seen it in my practice only one time. And I can tell you that we don't know for certain whether or not the Johnson & Johnson vaccine is linked to Guillain-Barre, but it's something we need to address. It's something that people should talk to their doctors about, especially if you have a history of Guillain-Barre syndrome, or especially if you have a history of neurologic conditions. But it is extremely, extremely rare. That is so important for everyone to take home from this. There's been 12.8 million doses of Johnson & Johnson vaccine administered in the United States, and there's only been about 100 cases of Guillain-Barre that has been reported. So we don't know if this is necessarily a side effect of the medication or if this is just happens to be that these patients develop Guillain-Barre. And in general, if you look at the population, Guillain-Barre is very rare, and it may just be happenstance that these people developed it as well, who also had the Johnson & Johnson vaccine.
Just got 3 questions left for you, doctor. I always talk to you about South Asians and the impact on them, especially the ones whose immune systems are compromised. What's your advice to them right now? Even if they're vaccinated, how much should they watch out for, especially with this Delta variant spreading?
So there's many degrees of autoimmune conditions, right? So I think it's extremely important for anyone who's concerned about their immune system to talk to their doctor about what's the next best step for them to take. I would say that if you're concerned about being outside and your risk of being around people who have COVID-19 or the variants that are out there, you should always err on the side of caution and continue wearing your mask, continue doing social distancing measures until we're out of this pandemic. I think it's easy to forget that we're in a pandemic when everyone around you is no longer wearing a mask, but it's still extremely important to be vigilant about your surroundings. And you should definitely talk to your doctor because many people who have low immune responses may potentially also have a low immune response to the COVID-19 vaccination, which means that they may have to wear a mask at baseline, even independent of getting a vaccination.
And the important part of that is, doctor, this pandemic is not over yet. It is not over, and people need to understand that. Another question I have for you is, Tokyo has banned spectators from the Olympics. Huge news. Japan has declared a state of emergency in Tokyo. Do you think it's a wise decision? And another question following that, should Olympics even be happening right now with what's happening on that part of the world?
It's a difficult question to answer, Aditi, mainly because, we postponed the Olympics for 1 year and everyone's anticipating this, and every country is trying to go back to some sense of normalcy, which is why I believe Japan is probably continuing on with, the Olympic Games. But in terms of the spectators, I do think that's a great step for them to take. I do think it's important because they're seeing a rise in cases of COVID-19. Japan had a devastating impact from COVID-19 over the past year, especially during the initial surge. Hospitals were burdened, people were dying, and those are things that we can't forget. It's also important to look at their vaccination rates. In Japan, vaccination rates are at 20% of the population or less that have actually been vaccinated against COVID-19. And so having such a low number of people that have been vaccinated, we know that there's a risk for people to spread infection and for that transmission risk to be extremely high. So that's why they made the decision to limit spectators so less people get sick. And I think that's imperative. And I think the great thing is, at least for those that are engaging in the actual Olympic activities, the athletes especially, they've all been vaccinated against COVID. They're trying to do the best that they can in terms of social distancing measures. I think all of that's helpful to try to at least continue on, and I look forward to watching it on television. But it's going to be a little bit different this year, and that's okay.
Yeah,
it's better than sorry.
No, important thing is they're taking precautions. That's the most important thing. My final question to you, doctor, I would like to know your prediction for the next month or two. Where do you see it going, and should we be worried about a surge?
So when you look at the trends of what COVID-19 is doing in the United States, it's somewhat reassuring. There's less deaths that we're seeing around us. But now with this uptick in cases that we're seeing with the Delta variant, I am nervous for the future and what to see in the next few months, mainly because there are still so many states that are not at the place we want them to be in terms of their vaccination rates. There's still states that have less than 40% of their population vaccinated, which is a breeding ground for more COVID-19 cases. It's a breeding ground for the potential of having new mutations, and the new mutant strains that could develop is what I'm most fearful of. So I am nervous for what's going to happen in a month from now. I hope that more and more people get vaccinated. But if you look at the actual vaccine trends in the United States, you'll see that they're relatively flat over the past few months to weeks, meaning that it hasn't changed much. So I think we need a very aggressive public health education campaign. We need to get into those communities where vaccine rates are very low and try to do the best that we can to get more and more people on board to help themselves, but to help the community, which ultimately affects the entire nation.
Yeah. Vaccines.gov is the website to go to find locations near you and also read a lot more on the COVID-19 vaccine. Dr. Adimoolam, thank you so much for your time here on ITV Gold.
Thank you. Thank you so much for having me again.